23.5 million. That's how many individuals that currently live in a food desert in America. A major study found that out of 28,050 zip codes in the United States, 29% of the zip codes do not have grocery stores or a supermarket, and 74% do not have a chain grocery store. Moorhaven, Florida is one of the zip codes that is considered a food desert. Moorhaven is a small town in Glades County, Florida that has a population of 1,680 residents. The town is located in southern Florida along Lake Okeechobee and just north of the Everglades. Moorhaven has been battling many different issues within the community. One of the biggest public health issues that they are facing are food deserts and lack of access to healthy foods. For many residents in Moorhaven, the closest grocery store is a 45-minute bus ride. There are no close, fully stocked grocery stores, and the only kind of grocery stores they have are mini-marts, which do not include fruit or vegetables most of the time. Also, products at these stores tend to be a little more expensive compared to the bigger grocery store chains. Food deserts are specific areas that lack fully stocked grocery stores and affordable healthy foods, such as fruits, vegetables, whole grains, milk. Food deserts are also considered areas that are at least a mile away in urban cities from a grocery store and 10 miles away in rural cities from a grocery store. Living in food deserts can affect the diets of those who live in them. Small stores, which are more prevalent in these areas, mostly sell unhealthy, packaged, or frozen foods. Having a diet with limited fresh produce lacks essential nutrients. Of the 23.5 million people who live in food deserts, about half of them are low socioeconomic status. About 2.3 million people living in food deserts are rural individuals, and they live 10 miles away from the closest grocery store. Studies suggest that this number may be underreported and the actual number could be much higher. Small convenience stores, which usually sell mostly processed packaged foods and are classified as the same way as bigger grocery stores like Whole Foods and Kroger. This means that some small towns are not considered a food desert because the small convenience stores in the town are comparable to the big chain grocery stores in bigger cities. The lack of food deserts for Moorhaven could be a factor that contributes to the town's high obesity rates. The obesity rates for Glades County, Florida is 35%, which the national average is 25%. This means that 1 in about every 3 people in Glades County, Florida is considered obese. The high obesity rates could also contribute to the high diabetes rates currently happening in Moorhaven, Florida. Of the 1,680 people living in Moorhaven, Florida, about 12% or 200 individuals have diabetes. The problem that will be addressed in Glades County, Florida is the rural food deserts. The main goal of the intervention is to increase access to fruit and vegetables in the area. There are many components that factor into the food desert epidemic: socioeconomic status, geography, lack of knowledge. The factor that will be focused on in this intervention will be geography and the location of grocery stores. Specifically, the intervention will look at the barriers of geography and location of grocery stores and how to address this issue. Geography of certain communities and grocery stores can make it very difficult for communities or individuals to have access to healthy foods. Lack of access to healthy foods can lead to individuals and communities being overweight or obese. Transportation tends to be one of the biggest barriers that holds individuals back from obtaining healthy foods daily. Most food deserts happen to be in low-income areas where the chances of individuals owning a car are very low. There are many interventions that address the barriers of geography in the community and how far it is from the closest grocery store. But the intervention that I found that would address the food desert issue in Moorhaven is an intervention called Produce on the Go. The intention of this program was to increase the food access in the community and improve diet and behavior, ultimately leading to a reduction in obesity rates within the community. Produce on the Go is a program that's located in Merced County, California, and developed from November 2013 through May 2015. This program was funded by multiple organizations, including Merced County Human Service Agency, California Fresh Works, and the United States Department of Agriculture. The program had a cargo van to sell the produce in, and an 18-wheel refrigerated semi-truck to store the produce, and that would go to multiple locations within Merced County for individuals to purchase the fresh produce. In November 2013, the program was only going to 10 different locations, but by the end of May 2015, the intervention expanded to 19 different locations. Some locations the program went to were local elementary school parking lots and churches, where it was very convenient for the community to obtain the produce. All of these locations were targeted towards low-income Latino majority communities. This program also offers nutrition education classes and cooking classes to increase the individual's knowledge on healthy foods. This intervention would address multiple causes and effects of the food deserts in Glades County, Florida. One of the first cause and effects the intervention would address would be the location of the closest grocery store. The intervention will make more healthy options available, and it will cut the distance from the closest grocery store. Another cause and effect the intervention would address would be the lack of knowledge of healthy foods and how to use the produce. Having the diet and physical education classes will increase the community's knowledge on healthy behaviors. Changing the health behaviors in the community will potentially decrease the obesity rates within the community. Finally, the last cause and effect the intervention would address would be the socioeconomic status in the community. The average household income in Glades County, Florida is $37,385. This means that the majority of the community is low SES, causing most individuals to not be able to afford produce, especially if the produce is more expensive. The intervention could sell the produce at a lower price and make them more affordable, and making the produce more obtainable for individuals. This intervention will also be beneficial because it will address the community's obesity epidemic. Having this type of intervention in Glades County could potentially help decrease the obesity rates in the community. Besides bringing fresh produce to the community that have a hard time obtaining them, this intervention also gives diet and physical activity education classes. This helps with the community's self-efficacy. If they are taught what kind of foods are good or bad for them and how to exercise, will also help change their health behavior. They will also most likely be able to continue making healthy decisions on their own. This community already has a local food bank. This means that the community will be more accepting for outside help in bringing this intervention into the community. This intervention could also partner with that local food bank to help the program grow and make it more known within the community. Some community partners that will need to be contacted to make this intervention happen in Moorhaven, Florida will be local government, USDA, California Fresh Work, Merced County Human Services, and the Harry Chapin Food Bank. All of these organizations have a basic common goal for the community of Moorhaven, Florida. They all want to be able to help those who struggle to afford food for their families. Also, having all of the community partners to network with one another will help each other out by advertising each community partner. This common goal will facilitate partnerships between these community organizations. Overall, food deserts are a serious problem all around the nation, and that needs to be corrected. There are many factors that need to be considered when looking into this issue. Some of the key factors that need to be addressed is the accessibility to grocery stores and healthier food options, and the price of healthier food options. If the accessibility and the price of healthy food options were more obtainable for individuals living in the food deserts, the rates of obesity are most likely to decrease in the area. Having more affordable, healthy foods can change the diets of food desert individuals and influence them into eating healthier and more nutritious diets. Changing the diets of obese individuals can also lower the rates of obesity-related expenses and government healthcare spending. Making healthy foods more accessible and affordable can have a huge impact on the nation, and it can make a difference to the individual's health, economically and socially. Thank you.